Good afternoon. It's really great to be here. I thought that I would talk about a subject that's really particularly important as you begin to put together your toolkit to really make a big difference in how we're going to change the face of modern surgery as we move along. So I'm going to talk about allyship. I have no disclosures. I put this up because on a beautiful snowy day in Denver, I thought that I would just say, this is where I'm from, and this is where it's nice, right? So I'll give you an overview, some definitions, I'll review the literature, and talk about a course. We have a course for residents now that we started to develop within the last couple years since what has happened in terms of the George Floyd upheaval, really, and his murder that led to really significant social change in the United States, we hope. So allyship, what is it? It was the word of the year. So December 7th, it came out the word of the year. It's a status of a person who advocates actively for someone who needs support, who are marginalized and have been particularly politicized in all areas of society. So it's an important word just for you to know, and I'm gonna go through some other definitions as I move along here. This is a study here. This is actually from University of Michigan, not that you do everything perfectly, right? But I figured I would embarrass you, Dana, right? Dr. Tellum, right? So this is a study that was University of Michigan looking at factors associated with barriers in allyship and academic surgery. And the main thing here is it was a survey, it was internal, so it wasn't a huge study, but it was something that was important. And there were really 5 themes that emerged here that in terms of allyships and academic surgery, so in our profession, recognizing bias, the timing and nature of the response when there's a microaggression, what the barriers are to address this bias, and additional emotional support, because every time these things happen, the person that happens to, they develop scars from these episodes. And this is sort of something that, if you looked at my back, you'd be able to see the number of scars that I have from all the things that have happened to me over the years. So an institution, departmental culture as a mediator response. So these are the different groups, recognizing what the timing of response is, looking at the barriers, what is the extra work for bias response, and it's really changing institutional culture, which this is a long-term project. It does not happen overnight. It's something that you have to identify, you have to see if you can fix it, and it takes little steps to do that. In terms of, I'll just sort of highlight just the middle there with the barriers, the fear of retribution. In surgery, we're very hierarchical, so you're not sure if this is the right thing to do. Will it impact your career? Will you not get promoted to the next level? You bring this up. Professional penalties, being labeled as problematic or angry, and those are things that I'm sure some of you can identify. Correcting the aggressor, particularly if there's a big power differential, that becomes a major problem. And then, of course, other things that I won't mention here. So to conclude that the effect of equity and inclusivity at one academic institution and what the findings were. And it gives you a basic framework to identifying bias and partner with colleagues to address this. And obviously there's limitations because it's one center, but it's an important first step just for help to clarify what's going on with that. I wanted to put this up just to kind of so you could take home some terms. I think you've heard privilege, microaggressions, but ableism, that means that you're looking down on someone who has a disabled and calling them names that are unacceptable. Benevolent sexism, which is you say, well, I can't give this to a woman because she's not able to do it because she's not able to do it like a man, which is, to me, unheard of, right? And opportunity gap, where there's not enough opportunities for folks, and when they open up, they give it to someone who perhaps may be less deserving. So these are terms that you need to just be aware of, and we'll go through those more in detail. And I think you've heard of this movement here, the he for she movement, that started, and I'll go through some of this in history. It's really a commitment to cultural change, introduce bias literacy, provide counter stereotypic exposure, which is all the things that we've been talking about here, encourage mentoring and sponsorship, and we're empowering the individuals. Like, you don't move up the food chain in academic surgery unless somebody is actively sponsoring you to move up, and that's important. We have to do. I think you know where it started. If not, I'll just mention to you the he for she movement was sort of credited with a speech that Emma Watson gave, who was she's a actress, but it really sort of engaged to get men really to help women to be successful. And this is allyship is something that's quite important there. And this is another study on allyship that was done by Dr. Antonoff, who's a cardiac surgeon down at MD Anderson. It surveyed the members of Women's Thoracic Surgery Group. The thing I think I wanted to bring about this is that women, even the other women in the department, they did not feel that they had allies in other women in the department. And this is sort of something that we need to be mindful of, that we're not supporting other people that you think that you would support. That they didn't think they got support from the chair, and they actually did not have support also from their male counterparts in the department there. So the themes that came up was disrespect, discrimination, stereotype, and unconscious bias, as you can imagine. This is another study. This is really a discussion. It was an opinion piece by Doug Wood, and I don't have a lot of time to go through this, but I think recognizing that women are a huge part of our surgical workforce, and we need to make sure that they're accepted and really welcomed into the leadership of academic surgery. A lot of things that you can read this in detail, but these are do's and these are don'ts, right? And I'm not going to, concentrate on the do's, but I'll say the don'ts are: don't develop the bro culture, tell stories, jokes related to sex. These are simple things that you should not be doing in your operating room. Don't mansplain. Right, that's the kiss of death, right? Other don'ts, there's many do's of, supporting role modeling, doing all the positive things to bring women up and be successful, and don't accept male-only committees. This panel is definitely not like a mantle up here, which is a beautiful thing, right? So I'm going to talk a little bit about allyship. We have a course that we give for our residents, and basically what it does is we do 4 two-hour sessions over the years just to sort of get them to us, because the reality, if you look at things, the medical students are really way ahead of us, right? The residents are ahead of us, and as the faculty, we're sort of coming up behind. So what we did is we sort of, in our place, we're beginning educating our faculty, the residents, and the medical students. Actually, they're overhauling our curriculum with a lens towards equity, which is something that many of your places may be doing already, but it's something that they're, but this is something that we start out with this, they're small groups. This has been done on video because the last 2 years because of COVID, but really sort of getting people, right, to sort of step back, think about things. There's no beepers, there's no phone calls, so they can really think about this, and it's a confidential discussion, and this has really been a great format for that. So it's something you've seen, the comfort zone. We kind of all sit in the comfort zone, but getting into the stretch zone and even stretching out farther than that can cause you to be a little uncomfortable. But I think as we sort of begin to approach this, we have to be comfortably uncomfortable, right? Because there's a lot of stretching that has to be done as we sort of do that. So introduce your name, the pronouns, department. You may see that everybody has their pronouns out on their, or you should have it on your Zoom when you're there, but it's important to do that. How you identify yourself, a surgeon, scientist, health services researcher, trauma surgeon, how do you identify yourself there? Diversity takes many shapes and sizes, and I think you've seen this before, but sort of defining what inclusion is, so we kind of go through a discussion of that, how important it is to make sure everybody's at the table as we do that, talk about barriers, and I think you've seen this before, the equity where there's reality where some people have much more privilege than others, right? Equally, we have everything equal, but you can't really see over the fence, and then equity means that you can see over the fence, but justice means there's no fence and everybody can kind of see things. So that really kind of gives you a sense of what that is. So we talk about privilege and power because there's a power differential. We're going to kind of talk about that in a little bit, with that. And what are the examples of your privilege? So we'll stop for a moment. We'll ask them, well, what is your privilege, right? Was it where you grew up, your financial status, your parents, your skin color, and so forth. So we talk about that in detail there. So I think this is I spent a moment of time there. This is allyship. So what we want to be is in the left upper quadrant here. This is authentic allyship, and that's where things are done. People do it because they mean it. They're making substantial change. You can see it in terms of departments and what have you. But there's also other things, in terms of performative allyship, where they say they're going to do something, but they don't really do it, right? And that sort of brings in this issue of white fragility, centering around yourself, and then moving down below there's white fragility, but weaponizing it and doing negative things because of that. So understanding what this really means, so what authentic allyship is and what performative allyship is important for you to do. So, lifting others, advocating, shared growth opportunities with others, making sure people know what's going on, not venting as a personal attack, recognizing systemic equity, mentoring, sponsoring, shaping policy through our respectful institutions and professional societies. And I think having forums like this is sort of something that is incredibly important as we sort of move forward with this. You know, everybody has a QR code, so we give the QR code, and they basically fill out a survey as we go along. We talk about the diversity wheel. You've seen different examples of this already in the talk, so I'm not gonna dwell on that. But there's things you can see, and there's other things that you can't see. So what we try to do is pull people out and have them discuss that. But then we do a privilege exercise for a bit where we talk about, well, what is your actual privilege, right? Are you young? Are you attractive? You know, are you white, right? Are you heterosexual, European heritage, right? And that would be sort of the dominant above, whereas where you in more of an oppressed group where you're underrepresented in medicine, non-European, LGBTQ, all different, disabled, unattractive, so all these things. So we kind of talk about that, and people then begin to sort of pull things out. So in a small group, our residents we worked with over a couple of years, they've really been open about discussing this. And this is sort of something that is really important, because the first thing you got to recognize is, we talked about recognizing your bias, but you got to recognize your privilege, right? If you haven't, you got to recognize that. So we talk about what surprised you, you know, what didn't surprise you, what you affect. So we're trying to move towards making sure that we have an anti-racist institution and department, and there's another QR code then we wrap up what you found surprising. We talk about what you can do, and people get really motivated after this, and many of the residents have done that. So I'm coming up on the end of what I'm going to say, but this is a picture of our brand new hospital and what it looks like. So just in conclusion, so Allyship, and we'll open up for questions from you afterwards, and we have some questions that are automated that we'll have. So Allyship is really essential to advancing diversity. We heard about implicit bias, unconscious bias, all these things, but allyship is the thing that will lift us all up and make us all better. Understanding the history and how it will develop, the whole he for she movement I talked about, and the tools for how to be a better ally as we move forward. And there's performative allyship versus actual authentic allyship, and that's sort of something that you need to make sure you have in the back of your mind. Are you doing this for real? We're going to really make a big difference with this change, or we're just doing it because we're saying we're doing it. Training our students, residents, and fellows, because the younger folks will be ahead of us, and we will need to be educated. And you have to understand that you need to learn as you go forward. But I want to thank you for your time this afternoon, and I'm happy to take questions.